Before antibiotics and modern surgery, doctors came up with some truly horrifying ways to treat their patients. We're talking about monkey testicle transplants, drilling holes in skulls, and treatments that killed more people than they saved. Bundle up and ready yourselves as we dive into these absolutely insane medical practices from history. Let's begin with number 15. Puppy urine face masks. In the 16th century, women seeking the perfect complexion turned to an unusual beauty treatment: puppy urine. That's right, women would actually apply fresh puppy urine directly to their faces, believing it was beneficial for their skin's health and overall appearance. Now, historians have debated the exact application method. Did these women collect the urine first in containers, or did they simply hold puppies over their heads and hope for the best? The historical record remains frustratingly unclear on this particular detail. What we do know is that this practice was considered a legitimate skincare routine among the upper classes, and it's worth mentioning that thankfully this particular beauty trend didn't survive into the modern era. Number 14. Tobacco as plague prevention. During the Great Plague of 1665, when the disease was ravaging England and killing thousands, doctors and authorities were desperate for any solution. One of the recommended preventative measures was actually quite surprising: smoking tobacco. In fact, the practice was taken so seriously that at Eton College, one of England's most prestigious schools, young boys were not just encouraged to smoke, they were actually paddled and punished if they refused to do so. The logic at the time was that the smoke would purify the air and protect against the deadly miasma thought to cause the plague. As you might imagine, this created a rather bizarre scene of school children being forced to light up as a health measure. While we now know that tobacco doesn't prevent plague and is actually harmful in its own right, it's a fascinating glimpse into how desperate people were during this devastating pandemic. Number 13. Therapeutic stink. Speaking of the plague, some medieval doctors took an even stranger approach to combating the Black Death. Operating under the medical theory that like cures like, these physicians believed that since the plague was thought to be caused by deadly vapors in the air, the best defense was to fight it with what they called therapeutic stink. Some doctors urged families to keep goats living inside their homes, filling their houses with the pungent smell of the animals. Others took an even more creative approach. They recommended that people collect their own flatulence in jars. Yes, you read that correctly, jarred farts. The idea was that whenever the plague appeared in the neighborhood, residents should open these jars and take a deep whiff of the stored gas. While this treatment was obviously ineffective and likely made the Black Death experience even more unpleasant, it demonstrates the lengths people would go to in their search for a cure. Number 12. Maggot therapy. Now, here's one that might actually surprise you with its effectiveness. The use of maggots to clean wounds has been practiced for centuries, and while it fell out of favor with the arrival of antibiotics in the 20th century, the method has actually made a remarkable comeback. Hospitals today use medical-grade maggots to treat conditions like leg ulcers, pressure sores, and infected surgical wounds, particularly in patients who don't respond well to traditional treatments. The science behind it is actually quite elegant. The maggots eat only dead and infected tissue while leaving healthy tissue intact, and their secretions help promote healing. What makes this practice especially interesting is that it's one of the few ancient medical techniques that has been validated by modern science and reintegrated into contemporary medicine. If you're squeamish about the idea, just remember, sometimes the old ways really do work best, even if they make your skin crawl. Number 11. Leech therapy. Ancient Egyptian physicians believed that leeches could cure symptoms for a wide variety of illnesses, from fevers to flatulence. The practice continued for thousands of years, though some applications were more disturbing than others. In the 1800s, women had leeches placed in their vaginas to treat conditions like vaginal discharge and cervical cancer. Even more shockingly, leeches were applied directly to the clitoris to treat what doctors called nymphomania and other so-called female complaints. Now, before you write off leech therapy entirely, it's worth noting that leeches still have legitimate medical applications today. Modern research has found that leech saliva promotes circulation and speeds the healing of damaged tissue. The leech has become invaluable to surgeons performing delicate procedures such as limb reattachments, skin flap surgery, and breast reconstruction. So while the historical uses were often misguided and harmful, the humble leech has earned its place in modern medicine. Number 10. Electric eel pain relief. The ancient Greek doctor Galen, whose medical writings influenced Western medicine for over 1,000 years, recommended a rather shocking treatment for headaches and facial pain: electric eels. That's right, patients suffering from these conditions would receive therapeutic shocks from live eels. The Greeks and Romans also used eels to treat gout, with patients instructed to stand on an eel until their foot became completely numb. While this might sound absurd, it's actually an early form of what we now recognize as electrical nerve stimulation. The patients were essentially receiving primitive electroshock therapy. This ancient practice paved the way for modern treatments, though thankfully today's methods don't involve standing on slippery, shocking fish. It's a reminder that sometimes our ancestors were onto something, even if their methods seem bizarre by today's standards. Number 9. Bezoars as arsenic antidotes. In the 1600s, when aristocrats lived in constant fear of assassination by arsenic poisoning, they turned to an unusual protective measure, bezoars. These hairballs, typically harvested from the stomachs of goats and sheep, were placed in drinks to absorb any arsenic that an enemy might have slipped in. Now, you might think this is pure superstition, but here's where it gets interesting. Modern research has actually proven that the ancient method was effective. The sulfur compounds in the hair proteins of a bezoar can bind to the toxic agents in arsenic, rendering them harmless. Of course, the drinks containing dissolved hairballs were reportedly horrible, but for paranoid nobility, that was a small price to pay for staying alive. It's one of those rare cases where folk medicine turns out to have a solid scientific basis, even if the method itself is absolutely disgusting. Number 8. The barber surgeon's bloody business. The ancient medical practice of bloodletting involves draining blood from the body to help cure disease. Believed to have originated in ancient Egypt, this practice was the main therapy used by doctors for thousands of years. In the Middle Ages, bloodletting was often performed by barbers, which is why the traditional barber's pole, like the bloody towels that once hung outside barbershops, is colored red and white. After a 12th century church edict prohibited monks and priests from performing bloodletting, barbers added the procedure to their list of offered services, along with cupping, tooth extractions, lancing, and even amputations. To determine a patient's health, a barber surgeon would study the color of the patient's urine and sometimes smell and even taste it. Yes, taste it. Patients frequently died during treatment by bloodletting, and perhaps the most famous victim was George Washington himself, who died after giving 5 to 7 pints of blood in just 24 hours in an attempt to cure a throat infection. That's nearly half of the blood in an adult human body, making it clear that sometimes the cure really was worse than the disease. Number 7. Trepanation, drilling into the skull. Trepanation, the medical practice of cutting holes into the skull, dates back to the Stone Age, making it one of humanity's oldest surgical procedures. Ancient Egyptians believed that trepanation could help alleviate pressure on the brain, while physicians in the Middle Ages thought the practice would release evil spirits from the possessed. Remarkably, skulls with evidence of trepanation have been found all over the world, and many show signs of healing, indicating that patients actually survived the procedure. Even more surprisingly, trepanation is still used in some countries today to treat ailments ranging from fatigue to epilepsy to depression, though modern applications are far more controlled and scientific. Of course, if you were depressed before the procedure, you're probably still depressed afterward, but at least you know why. You have a gaping hole in your head. While most modern uses of trepanation are legitimate medical procedures to relieve pressure after brain injuries, the fact that this Stone Age practice is still around is a testament to human desperation in the face of suffering. Number 6. The Whale Carcass Hotel. Now this one might be the most bizarre entry on our entire list. According to an article from 1899, there was a hotel in Australia that offered a unique treatment for rheumatoid arthritis. Whenever a whale died near the coast, patients would be rowed out to the massive carcass. Then, workers would cut up the whale and carve a narrow hole into the body. The patient would then crawl inside and lay down in the decomposing whale blubber for around 2 hours. This process allegedly relieved soreness and inflammation. And here's perhaps the best part. The treatment was reportedly discovered by a drunken man who was staggering along the beach near the whaling station at Twofold Bay, and who, seeing a dead whale cut open, took a header into the decomposing blubber. Only after emerging did he realize his aches and pains were gone. While we have no scientific evidence that this treatment actually worked, one can only imagine the smell patients had to endure and the bath they required afterward. Number 5. Dr. Cotton's organ removal therapy. In the early 1900s, one American doctor took the concept of treating mental illness to a horrifying extreme. Dr. Henry Cotton believed that mental illness was caused by infected body parts, and his solution was simple: remove them. He would begin with the extraction of teeth. If that failed to cure a patient's mental illness, he would move on to removing organs such as the tonsils, stomach, and large intestine. More than a third of Dr. Cotton's patients died from these procedures, yet he continued his work for years. By the end of his career, Dr. Cotton had removed thousands of tonsils and teeth from patients at his hospital, a hospital that, as you might imagine, served a lot of soup. What makes this story particularly tragic is that Cotton worked at a legitimate psychiatric hospital and was initially respected in his field. It took years before the medical community fully recognized the horror of his methods and shut down his practice. Number 4. Monkey and goat testicle transplants. What was a poor guy to do in the 1920s when things went awry down below and no one had invented Viagra yet? Well, if he could afford it, he might hop a ship to Paris to see Dr. Serge Voronov, who would happily replace the man's testicles with those of a monkey, promising that this treatment would restore vitality and virility. Meanwhile, in America, John Brinkley became one of the richest doctors in the country. Despite having no medical qualifications whatsoever, he claimed he could cure impotence, infertility, and other sexual problems by surgically implanting goat testicles into a man's scrotum. Few patients objected to carrying around animal gonads. For one thing, many were told their new testicles had come from inmates, not primates. For another, the promise of restored sexual function was too tempting to resist. Unfortunately, the surgery had no scientific merit and was extremely dangerous. Many patients died from these procedures, and those who survived gained nothing except the knowledge that they were now walking around with animal parts where their own anatomy used to be. Number 3. Hemiglossectomy for stuttering. What's the best treatment for stuttering? If you ask doctors in the 18th and 19th centuries, many would tell you to cut off half the patient's tongue. This procedure, called hemiglossectomy, was performed on countless individuals who struggled with speech impediments. The logic was simple: if brutally misguided, if you can't speak properly, reduce the tongue's ability to move. The procedure was performed without general anesthesia. That luxury didn't exist back then, meaning patients endured unimaginable pain. But pain was only one problem. The treatment didn't actually work, and many patients bled to death from the procedure. Today, hemiglossectomy is still performed, but only as a legitimate treatment for oral cancer, and it's done under general anesthesia with proper medical protocols. It stands as a stark reminder of how far medicine has come and how much suffering was inflicted in the name of treatment. Number 2. Victorian treatments for female sexuality. Victorian-era medicine took a particularly dark turn when it came to female sexuality. Women who showed any interest in sex were often labeled as mentally ill nymphomaniacs. The concept was first laid out by French physician M.D.T. Bienville in his 1771 treatise, Nymphomania, or a dissertation concerning the furor uterinus. Among the behaviors Bienville cited as symptomatic of nymphomania were dwelling on impure thoughts, reading novels, and eating too much chocolate. The treatments for this so-called condition were horrific. They included enemas, leech treatments applied directly to the genitalia, and even clitoridectomy, the surgical removal of the clitoris. Dr. Isaac Baker Brown, a British gynecologist, was particularly notorious for recommending clitoridectomy for any woman who masturbated. Victorian doctors also believed that male masturbation could lead to insanity, blindness, and death. Boys who were caught masturbating risked having their foreskins sewn up with only a small hole left for urination, or having their hands tied to their bedposts at night, or being forced to wear straitjacket pajamas. These barbaric practices were performed in the name of medicine and morality, causing untold suffering to countless individuals whose only crime was normal human sexuality. Number 1. The rise and fall of lobotomy. And finally, we arrive at number 1. And it's perhaps the most disturbing medical practice on our entire list. Lobotomy involves severing connections in the brain's prefrontal cortex and was used as a mainstream procedure in some countries. What makes this especially chilling is that the originator, Portuguese neurologist Antonio Egas Moniz, actually won the Nobel Prize in 1949 for what would later be recognized as one of medicine's greatest failures. In America, Dr. Walter Freeman took the procedure to horrifying new levels. In 1945, he began experimenting with an ice pick from his own kitchen, testing the idea on grapefruits and cadavers. The procedure was simple and brutal. The ice pick was placed behind the eye socket, and a hammer was used to break through the thin bone, driving the instrument into the frontal lobes. Freeman claimed he could perform it without anesthesia or even surgical scrubs. Freeman became a barnstorming crusader, performing 2,500 lobotomies in 23 states. He liked to shock audiences by hammering ice picks into both eyes at once. In 1952, he performed 228 lobotomies in 2 weeks, lobotomizing 25 women in a single day. His most famous victim was Rosemary Kennedy, JFK's sister, whose lobotomy left her unable to speak more than a few words for the rest of her life. Despite a mortality rate of 14%, Freeman performed over 3,400 lobotomies, including on children as young as 4. His final operation was in 1967 when his patient died of a brain hemorrhage, and he was finally banned from operating. Thanks for watching, everyone. I hope this journey through medical history has given you a new appreciation for modern medicine. Be sure to like and subscribe, and I'll see you next time.